Imagine you or a loved one experiences a sudden, severe headache or an unexpected injury, and you rush to the nearest emergency room. In that moment of urgency, a crucial question might cross your mind. Will they treat me, no matter what? The reassuring answer, for true emergencies in the United States, is generally no. A hospital cannot refuse emergency care. There is a very important federal law in place to protect you in these situations, ensuring you receive the medical attention you need during a crisis. This protection comes from a federal law known as EMTALA, which stands for the Emergency Medical Treatment and Labor Act. This law requires almost all hospitals with emergency departments to provide a medical screening examination to anyone who comes to the emergency room, regardless of their ability to pay or their insurance status. If the screening reveals an emergency medical condition, the hospital must either stabilize the patient or transfer them to another facility that can provide the necessary care. This means they cannot turn you away at the door if you are experiencing a medical emergency. Understanding your rights under EMTALA can provide immense peace of mind. If you arrive at an emergency room seeking help for something like a debilitating migraine, a suspected broken bone, or sudden chest pain, the hospital is obligated to evaluate your condition. They must assess whether it is an emergency and take appropriate action to stabilize you before considering any financial aspects or transfers. It is important to remember that EMTALA specifically applies to situations where a person comes to a hospital emergency department seeking examination or treatment for a medical condition. It does not apply to non-emergency situations or to hospitals that do not have an emergency department. For example, if you seek care for a routine checkup or a long-standing, non-urgent issue, the hospital's obligations might be different. The law also includes protections for women in active labor, ensuring they receive care until delivery or a safe transfer can be arranged. Knowing that a federal safeguard exists ensures that essential care is accessible during your most vulnerable moments. This law creates a vital safety net, allowing you to focus on your health and recovery without the added worry of being denied crucial emergency treatment.